Right. Good afternoon, everyone. Thank you for joining. In today's seminar, we have Dr. Taiwo from University of Ibadan. She's going to talk about an application of improved method of fuzzy matrix composition in medical diagnosis. You're most welcome, Dr. Taiwo.
Thank you. Good day, everyone. Yes, today in our weekly seminar, I will be presenting a talk titled An Application of Improved Method of Fuzzy Matrix Composition in Medical Diagnosis. So we have okay, there are some outline that we want to quickly check. Introduction, the classical sets. Before we have a fuzzy set, there is existence of classical sets. Then we move on to fuzzy matrices. We introduce it, get some basic definitions that will help us in the main talk. And also we look at the application, how to apply this fuzzy matrices with respect to medical diagnosis. So we have classical set. You have to review it. What do you mean by classical set? Generally, we have elements, a set of open interval 0, 1. Take, for instance, if we have a set of integer, and you have its subset to be set of natural number, and for any elements to pick from the subset, we assume is either 1 or 0. Then this will give us a membership function for that element, because we have just two options, 0 or 1. If the element is not in the subset, then we have 0. But if it's inside, then we have a O1. Then why do we need fuzziness in mathematics? It's because in real life situations that we are dealing with, it's not just about yes or no. The situation we are dealing with are not precise at all. If you come around and you say that, yes, I want a set of beautiful ladies, what is that parameter that you use to measure your own beautifulness? If you say you have a container that is big or small, what indicate the choice of your parameter? How do you say that, yes, you have a tall boy or a short boy? Or you can just say this, if this is not 1, it will be 0. It's not be at all time. How do we know the set of all natural numbers much greater than 5? You pick a set of natural numbers and you want to find set of that number that is greater than 5. You cannot say precisely that, oh, it is 4, oh, it is 6, oh, it is 10. There must be something to look at before you conclude your option. Also, the set of very beautiful ladies. How do you want to measure the very beautiful? What is beautiful to you might not be beautiful to me. What is handsome to you as a boy, it might not be handsome to me. What to consider very low might be high for me. What to think, what to consider as cost that you can affordable, it might be so expensive for me. So this brought about fuzziness in mathematics. So such cases, among others, are fuzzy, and any set with such imprecision is referred to as fuzzy set. In case we restrict access to only all of X completely in that subset, or not completely in X, we recover back our classical set. So if we stick at, okay, let's say for this, we have set of beautiful ladies, then we recover back our classical set. Let's say, okay, we restrict ourselves to not completely in X, then we recover back our classical set. And this fuzzy set that we're talking about has a wide application in almost every aspect of mathematics, in engineering and computer. Fuzzy set is being applied. Now that's all about fuzzy set. Also, we move on to fuzzy matrices. Why do we have to study Fosse matrices? Fosse matrices, though it's interesting and resourceful, and this Fosse matrices is an extension or generalization of classical matrices that we have, because we are dealing with situations in life that are not precise. So we have to factor in those factors that will make us to get a better and beautiful result. It is the generalization of classical matrices, as I've said. In fact, every Fosse matrix is a classical matrix, but the converse is not true. It's not necessarily true for a Fosse matrix, for a classical matrix to be a Fosse matrix. Fosse matrix has been extensively studied and applied to many fields, such as appointment procedure, learning techniques, medical diagnosis, to mention a few. The result shows that Fosse matrix theory produces effective solutions to various decision-making problems. Now, in this talk, what are we talking about? We're talking about how we introduce the improved method. There was a method in place, but we want to improve on it. And the method is Fosse matrix composition. And after the improvement, we apply it to medical diagnosis, because there was a method in place by Tsangodapo and Malika's approach. They used their own approach. They use Fosse matrix composition, and they apply it medical diagnosis. But we want to improve on that method. Okay, fine. You have your own method. Can we improve on it to have a better result? Because this we give the doctor a better value for them to, before they can prescribe any drug, or before they can prescribe any test for any patient. And the same hypothetical medical database studied by those two researchers will also be considered. Now we want to see some basic definitions. Fosse matrix, we have the example that this A is a 3x2 Fosse matrix. What we are looking at is that all the entries of that matrix must be in between 0 and 1, included 0 and 1. Also, we have the Fosse row matrix, we have Fosse column matrix. All these also are generalization or an extension of the classical matrix. We also have Fosse complement matrix. That is, when you take each of the entries away from 1, then you have the Fosse complement matrix for that matrix. And we have examples. For A, we have this, and for A complement, we have this. The first entry, that will be 1 minus 0.1, we have 0.9. So that's how we got the other entries. Also, we have a square matrix. In classical sets, also classical matrix, we have a square matrix, 2x2, 3x3, 4x4, and so on, n by n matrices. Also, we also have the same thing in Fosse matrices, that we have all the entries between 0 and 1 together with 0 and 1. Also, we have a Fosse diagonal matrix. We also have that all the entries at the diagonal, they are 0 and 1, and all the values between 0 and 1. We also have that we can also subtract also in Fosse matrix. This, we have two matrices, A and B. We can add up, we can subtract. By the addition, we take the maximum value for each of the entry. For the subtraction, we take the minimum value for each of the entry. 0, the first entry for A is 0, 0. The first entry for B is 0.1. Then we take the maximum for the addition, that will be 0.1. For the A minus B, we take the minimum value. The minimum value will be 0. So we have this addition and also the subtraction. Also, we can multiply. The multiplication is what we define as the composition. Composition and Fosse matrix multiplication. We also have this. It's the same way we multiply the classical matrix, but the difference is just that the entry for each of A and B, we first take their minimum. Then after that, we take the maximum of the value. Then we arrive at the multiplication. For 0, is 0, 0, 0, then is 0.1. The minimum is 0, 0.0. For the other one, 0.9 and 0, 0, the minimum is 0, 0. Then also after that, we have some entries. Then we take the maximum from all those entries. We have the first entry for the matrix multiplication, which is 0.50. So all these definitions will help us when we are to do our the application, because we need all this. We need to subtract some matrices. We need also to find their products. And also the composition of matrices by these two researchers, Sangodapo and Malika. They said that, okay, fine, we can also use this to find the multiplication of matrices. And we discovered that the same way that we do matrix multiplication in fossil mathematics. So it's the same way, nothing changed, except they redefine just the definition of the matrix multiplication. But now we now come up with an improved method. That's okay, fine. If we have A and B, we can find the average of each of their entries, the average of the addition of each of their entries. Then after that, we find the maximum. What will this give us? It will make the value to be much more better than that of the normal method used by those two researchers. We will see it in the application. Also, we have example. So when we use that, the same matrices A and B that we have used before, we arrived at all these entries, and we will see that the entries we have there, they are much more higher than the one we have for this, which is telling us, which has an implication in our application. Also in our application, we also make use of this relative function defined this way. We also make use of that. Also, we have comparison matrix. We also make use of this. So all these will be used in our application. Now, the procedure, what do we need? What are the steps to follow for us to apply this improved method in medical diagnosis, and what will be the results? What do we want to achieve after this? Now, the first thing to do, you construct the fossil matrices A and B corresponding to the two fossil sets. We form the complement matrices. You compose the composition matrices A and B, and that of the composite matrix for their complement. We also compose the difference fossil matrix, which will represent as C, D minus E. Also, we calculate the relativity values, and we form the comparison matrix. So this will tell us, after that, we must be able to identify the highest number for each patient in R. And this will make us to conclude that the patient's PI suffers from a particular disease, because if we are able to find the highest number, that will give us an insight that, oh, very sure this patient is suffering from this particular disease. So doctor will be able to prescribe maybe the normal test, maybe the normal drug for that patient. Now, the case study we want to see is that we have 3 patients, Jesse, Faith, and Paul. They have the symptoms: high temperature, headache, and they also have cold. Now, how do we decide? How do we know which one is suffering from all this? We also have 3 diseases. We have dengue, we have viral fever, and we have malaria. Now we want to see who among these patients is suffering for each of these diseases, or none of them is suffering from these diseases. So we want to see in our application. So we have this data with us, with the same data those 2 researchers used. So we want to apply our improved method. Now, the first thing to do, we represent the fossil set in matrix form. After that, we find the complement matrices, because we have indication in the conclusion. Why? Because this, now to find the complement, this is the 1 minus each of the entries. This is 1 minus this, 1 minus this, 1 minus this. That will give us the entries for A complement. Also for B, we have 1 minus 0.4, 1 minus 0.2, 1 minus 0.7. We give us entries for B complement. Then the next thing is to compute Fosse mathematics D and E. To compute that D and E, we are told that we have to find the using our improved method. We have to find the composition matrix D, that of A and B, and E, that of A complement and B complement. That will give us our two matrices A, D, and E. That's how we compute that. We find the average of each of the addition of each of the entries. And after that, we pick up the maximum from all those values that we constitute for matrices, the Fosse matrices D and E. Also, the next thing is to compute Fosse matrix C. Fosse matrix C, how do we do that? We are told that we have to compute the difference. The difference between D and E will give us Fosse matrix C, and which we have as 0.55, 0.60, 0.40, 0.50, 0.65, 0.55, 0.65, 0.60, 0.35. We have this. Then what do we do next? The next thing is to compute the relativity values. We want to see, is it at the same point? Is it at the same point where we have the highest value for the entries of C? Is it the same? Is that at the particular place also we have highest value for the entries of relativity, the comparison matrix. So we want to check that. If we are able to find the highest value at each entry, then we conclude, then we draw our conclusion. And this is how we find the comparison matrix. We find that the F of P, the patient ratio, the disease. Then we find for P1, P2, P3, D1, D2, D3. Then we have these values. Then here comes our composition matrix R, that is 0, 0.16, minus 0.38, minus 0, minus 0.16, 0, minus 0.08, 0.38, 0.08, then is 0. Then from matrices C and R, in C we have that at the second column, first entry, at the second column we have the highest value. For the second row, at the second column we have the highest value. Then the third row, first entry, we have the highest value. See the same thing with comparison matrix. Yes, now we also have at the same point we have for the first row, the first entry of the second column, we have the highest value. For row 2, we have the highest value here. For row 3, this is where we have the highest value. So from matrices C and R, we observe that patient, Jesse, and Faith, because the highest value, part of the procedure, the last thing we have to check in our procedure is that we have to identify the highest number for each patient in R. Then we have to compare this with with matrix C before we draw our conclusion. So that's what we are doing now. Now we have that, we observe that patient Jesse and Faith, because here we have highest value, here we have highest value. P1 and P2 are suffering from viral fever, and they are suffering from viral fever because D2 is viral fever, D3 is malaria, D1 is dengue. So we find out that Paul, which is the patient, the third patient, is suffering from this disease. So, and from here, we draw our conclusion. Because what we checked was that we have highest relational value than that of Tangaraji and Malikia. We have the highest relational value, because looking at their own results, we can, since we have the highest value now, you can still say, yes, there is highest chance of having that disease. Then we draw our conclusion. In this talk, we have seen the extension of this two researchers' work, their approach, how they apply it to medical diagnosis. Then the improved method of Fossey matrix composition introduced can say is more reliable in the sense that matrix C shows a greater relational value compared with their own matrix. Also, we can deduce from the comparison matrix R that the potency of the immune systems of the patients was stronger in fighting against the potency of the diseases compared to comparison matrix R in their own paper. There are two things we are looking at. For matrix C, we have greater regional value. Then for matrix R, we have that the patient have the stronger, that the patient was stronger in fighting against of the diseases compared with their own. And furthermore, the improved method put forward in this talk, together with the relativity function and comparison matrix, could be adopted in solving other multi-criteria decision-making problems in medicine and other related disciplines to get quick output in future work. So what the conclusion we are drawing here is that, no, they have their own results, but we discover that the values we arrived at are very are higher than theirs. And as a result, we can say that because this thing is checked, the matrix composition is being checked by highest relational value of with those patients and diseases. So since we have the highest relational value, you can conclude that as a result is better off their own approach. And also from the comparison matrix, you can see that each of those patients that they have the highest value, they have a strong immune system to fight against the potency of any disease they come across with. Thank you for listening.